So lymphatic preparation requirements include the understanding that the lymphatic system consists of lymphatic vessels, nodes, and lymph, the fluid that carries proteins, lipids, and leukocytes throughout the system. The lymph nodes, what they do is they filter impurities taken from the bloodstream. Lymphatic vessels contain blind capillaries where they exchange nutrition and waste with the cardiovascular system. The right subclavian duct drains the right part of the body, including the right arm, the right part of the torso, and the right half of the head, or the head, excuse me. The thoracic duct drains lymph from the rest of the body. Hematopoiesis occurs in the bone marrow. The lymphatic vessels maintain fluid balance and prevent something called lymphedema. Major lymph nodes consist of the tonsils that are found in the cervical area of the neck, the axillary, Peyer's patches in the gut, and the inguinal nodes. The lymph nodes and vessels help in fighting off infection throughout the body. And hematopoiesis, or the formation of blood cells, takes place in the red bone marrow, where erythrocytes are formed, thrombocytes are also formed, and it also includes leukocytes or white blood cells. RBCs, red blood cells, they aid in the perfusion of tissues throughout the body. The normal count is 4 to 6 million. Thrombocytes or platelets allow for hemostasis, or the cessation of bleeding, and the therapeutic range is between 150,000 to 400,000. Leukocytes or white blood cells allow the body to fight off infection. The therapeutic value of leukocytes is between 5,000 to 10,000. A CBC with differential includes the assessment of the red blood cells, the platelets, the white blood cells, but it also assesses the specific white blood cells, which include the neutrophils, lymphocytes, monocytes, eosinophils, and basophils. And the CBC also includes hematocrit and hemoglobin. Now, the application component is important because when a patient is undergoing chemotherapy, their bone marrow is suppressed and it leads to pancytopenia. Pancytopenia is the decreased count of all blood cells, red blood cells, white blood cells, and platelets. Post-gastrectomy and vegan patients are at risk for pernicious anemia. Post-gastrectomy patients require cyanocobalamin or B12 supplements monthly injections, whereas in contrast, vegan patients require daily supplements. Now, the reason why you give people injections of B12 when they're post-gastrectomy is because they lack intrinsic factors. So you must give them the B12 directly into the bloodstream for absorption. And when people are just not consuming foods with B12, which are of animal origin, like those people who are vegan, they just have to take the supplements orally. Erythropoiesis, or red blood cell production, requires a hormone called erythropoietin, but it also requires folic acid and B12 to successfully synthesize blood cells. Now, this is important for you guys to understand because a lack in any of those elements, erythropoietin, folic acid, or B12, will lead to a decreased production of those blood cells. After a mastectomy, or the surgical removal of the breast tissue, patients are educated not to have the blood drawn or a blood pressure taken on the affected extremity due to the risk of infection and or lymphedema. Aplastic anemia occurs when the cells in the bone marrow are not producing enough cells and anemia occurs. Thrombocytopenia, a lack of platelets, places the patient at risk for bleeding. Leukocytosis, or an increase in white blood cells, indicates that the patient is actively fighting off an infection or they have an infection. In something called sickle cell anemia, it leads to increased destruction of red blood cells and an increase in production of sickled cells or sickled erythrocytes. And the body normally, when they destroy them, they release more bilirubin, and this causes a lot of issues. Dehydration is a common cause of sickle cell crisis. For this reason, hydration is of the utmost importance when dealing with a patient who has sickle cell anemia. People with sickle cell anemia may also find themselves experiencing arthralgia or pain in the joint, and that's a common finding in sickle cell anemia. Leukemia is a blood cancer that causes a proliferation of immature white blood cells, and it causes erythrocytes and thrombocytes to also decrease. Now, this happens because in the bone marrow, during leukemia, your body produces an abundance of white blood cells. They're immature, they're not ready to fight off infection yet, but nonetheless, it's an overproduction of white blood cells. It congests the outflow of the rest of the blood cells as well, so you develop pancytopenia, where all the blood cells are also reduced. Folic acid and B12 play a role in the maintenance of the nervous system. Because of this, when either lacks, paresthesia or neuropathy may also develop because it deals with the maintenance of the nervous system and you don't have enough of them. And something called myeloma causes a decrease in bone marrow function. Precautions for anemia, infection, and bleeding should be considered for these patients as well.